Hi everyone, welcome to After Work Chats, and it's Tuesday, which means that we have our regular podcast with LK and Omar. And just so to remind everybody, LK is our duty manager, and Omar, you've seen him multiple times. And LK already introduced himself last time, so if you want to see who he is and check him out, go to our previous podcast or just check our website or his LinkedIn page. And today's topic is picked by me, and we decided to cover day-to-day news, what's happening in the healthcare management industry, and how it will affect us and overall everybody. And today we decided to focus on new developments in the industry, which is that AHA, which is American Hospital Association, is pushing for hospital at home changes. And we kind of wanted to chime in and say what we have to say about it and how will it affect outsourcing companies such as ours. And without further ado, let's start with the questions I prepared for our experts today. And we'll start with this rise in the demand for hospital at home. How will it affect the demand for outsourced healthcare services, such as MD Health Tech, for example?
Thank you very much, Glev, for having me again over here. Let me answer that question for you. Basically, AHA is doing a great job by pushing, the government to go ahead and expand it, the hospital at home care, because the after the success of it, we have all seen in the COVID days that it was very effective for everyone. Some, the people, even when they were, at home, they were at their work with no contact, assistance they were getting, they were liking it, and they were, the hospitals, the people were more comfortable with that, settings, right? And then it gave us the opportunity for the healthcare to go ahead and scale up their, services and scale up their practice at the same time, right? And for that, the most important thing is for any practice to scale up, they need the technical, expertise in that, and they cannot go ahead and hire every individual on their own. They need to go ahead and outsource some of their tasks, which includes, their technical staff, services like, remote patient monitoring, telehealth support, administrative tasks, the referrals, PCP calling for the patients, pre-authorization, medication pre-authorization, insurance eligibilities before the telehealth meeting can happen with the doctor, right? They need to go ahead and ramp up that, all right? And to go ahead and get that, integrated into their system, right? They will need some experts to do that for you. And that's where, the outsourcings will come in and go ahead and grab them before time. AHA is pushing very hard to do that. And it's better for, the healthcare agencies to go ahead and get themselves, ramped up as soon as possible before it's too late for them. And, there could be chances, that, things go beyond, and it could be time consuming. So why not prepare before time?
Okay, great. Moving on to our second question. So, with hospitals moving to expanding their at-home services, and we saw Mayo Clinic is doing this now, a big provider, and there are some others that are a little bit smaller, but still expanding and ramping up. What opportunities might arise for outsourcing companies?
Thank you, Gleb. I think if you remember, we did one podcast a couple of weeks ago that do one thing what you are best at. If you are a doctor, you will be doing what is good the doctor is, means whatever his specialty is. Same way in this, as this at home or remote patient monitoring experience is growing, people are learning. Remote patient monitoring is one of the example that Medicare has started. They have seen a lot of value that if they start talking to the patients at home, they are getting much better results, and they are giving a cure to the patient before it gets worse. Same way, by doing so, it is creating a lot of new job opportunities for the businesses where remotely a lot of the work can be managed. For example, if the nurse can talk to the patient 20 minutes remotely over the phone and provide in that information to the doctor, it can save. Just imagine if one patient have to leave home, and in this time and age, if the patient is dependent on others, and everyone is busy, sometimes patients do not get to the hospital because they don't have a care, they don't have people to provide the support. So this remote patient monitoring IoT device is the new era. Medicare is learning it. I am very much forecasting this what Medicare came up with, remote patient monitoring program. It will trickle down to the commercial insurance eventually, and when it will trickle down the commercial insurance, that plan will open up. We were talking to a couple of in Hawaii, couple of hospitals where they wanted insurance companies to cover remote patient monitoring for non-Medicare patients. So I think so. It will create opportunities. It will create again different specialized group. Like for example, for us at MD Help Tech, we do one thing remotely. We can get the prior authorization cover. We can do medication authorization. We can do telephonic support, non-medical, and many other IT work as well to make sure to keep the infrastructure safe and provide the support whatever needed for the patients. So I hope I answer your question.
Yeah, you did, and it seems like there's a lot of exciting things going to be coming up soon in the industry. As Omar said, it's a lot of exciting things, but on the flip side, there might be some challenges and some disadvantages to the platform, maybe. So, LK, what do you think is what challenges might outsourcing companies face as healthcare providers shift a little bit to this hospital at home model?
Well, the first challenges that the outsourcing company will face is, maintaining the service level, right? Because
Mm-hmm.
to maintain that, they need, they need to be able to cope up with the workload, right? Um, Managing the increase of risk and compliance, adapting pricing, staffing model, and everything, and that would be very hard for any new company to do. A company like MD Help Tech, which already has the expertise before time, we're not doing it since the AHA, pushes for the home, hospital at home care. We're doing it for a good time now, and we have a good client base already. So we have learned a lot. We have our data. We have everything. So that's why, for the new outsourcing companies for practices, they need to make sure that they're partnering up with the someone expert in the field rather than someone new, and then they have to train them what they have to do. Why not hire someone who's already trained and can take over the task right there and then from that point onward?
Okay, and Omar, would you want to add something into this?
Wonderful. I think so. I will add definitely the practices or the companies who are outsourcing these type of services, the biggest challenge for them is one, to maintain the staff. One thing is that we have a very huge presence onshore and offshore, and we have a very talented staff where we also provide and guarantee of a backup resource at no cost. Another thing is this is the secure IT cybersecurity. So we are ourselves an MSP provider. We know how to get the IT security. We are also talking to a couple of other compliance groups where they will come in and make sure that they will make the practice HIPAA compliant as well. Another thing is pricing could be a huge challenge that you need to provide a value-based pricing to their clients. So cybersecurity is one of the very most important thing. Also, the advanced technology, providing a backup resource, because managing resource in today's world is not easy. Wherever in anywhere part of the world, managing, maintaining resources is difficult. So I would say those couple of things we can add.
So, gentlemen, just to wrap up, wanted to get your final thoughts on this AHA push for this policy. What do you have to say? Maybe last suggestions and
Sure.
less
So
ideas.
thank you, Gleb. I know I took in between, but I think so. There's a four main takeaways from an outsourcing perspective or outsourcing companies they need to take care. One, they definitely to make sure that they have to provide a attractive pricing model, how to answer the staffing needs, especially specialized workforce and the flexible staffing. Because when you work in America, you are working into multiple time zones. It starts from East Coast and goes to West Coast. So how your flexible staffing will work. Biggest and the most important is the technology investment. Technology investment is not a low cost investment. You have the technology, hardware purchase, the services purchase. If you are not a technology company yourself, like us, MD Help Tech is also an MSP provider for a medical companies. We know how to take care of it with technology. So any advanced technology features that we need to provide in order to help clinics, doctors, at home patients, we can provide those services. Cybersecurity is the biggest thing. If we are not doing cybersecurity, it's a huge threat. So I think so. These are the four pillars are very important, which we need to take care.
Oh,
LK, do you
okay.
want to add anything?
Yeah, anything to add?
Yes, for medical practices, after this, the AHA pushes this and get it approved, a big wave of, workload is coming their way. There's a huge wave, which will, uh, be, a, a storm for them to handle. There would be reimbursement that needs to be done. They have to have an infrastructure. So basically, in easy words, the any medical practice is, a smaller, a bigger one, a hospital, a simple clinic, they cannot afford a downtime. That downtime can cause by, a natural disaster. That could be a employee taking a day off, or employee not showing up, or they are less on the workforce. That's where, the outsourcing company, an expert outsourcing company, can jump in and fill in those, gaps for them, with making sure, that there are no downtimes. And that's what, the mode of the MD Help Tech is. You go to our website, you check out, we are giving out zero downtime, since we provide a backup resource with, it doesn't matter what services you opt with us. The backup resource is always there. It's,
For no cost.
no cost at all. Exactly. No cost at all. Plus, we are working, if, of course, depending on the settings of the practice, we can work around the clock at the same time.
Thank you, everybody. Thanks for listening. Tomorrow we're going to have our AI in healthcare podcast. Stay tuned. Please like, subscribe, and leave us a comment, and listen to us on YouTube, Spotify, and Apple Podcasts as well. And see you tomorrow. Have a good day. Bye.